Maybe this video is a bit politically incorrect. Hey friends, welcome back to the channel. My name is Rohan. I'm now a 5th year medical student. It sounds a bit weird saying that. And I'm studying at the University of Cambridge. And today it's just a bit of a life update style video. So I'll be reflecting on 4th year, how that went, be sharing my exam results if you're interested, and also looking ahead to 5th year and what my plans are for that. I guess we could start by what I've been doing this summer holiday. We've had about a month off, which is a lot shorter than we're used to. Usually, like students, we get like 3.5 months off. So this has felt a lot shorter with us being at clinical school, but I guess that's what we have to deal with. And it's been pretty relaxing. I've been away to Scotland with my family. Also, we had like a lads trip to Abersoch, which is in North Wales. And yeah, I've just been doing like quite a lot of admin, getting ready for next year. I've been trying to plan my electives and yeah, mainly being at home, which has been nice. And 5th year is starting soon. It's starting on Monday and I'm recording this on the Saturday. So I'm gonna be driving back down to Cambridge tomorrow. Okay, so I guess we'll start with like my exam results and then we can talk a bit more about 4th year to give it a bit of context. Yeah, you're probably wondering why I didn't do a results like reaction video this year. And honestly, I was thinking about doing it, but then I was like, what's the point? It's kind of just for views. And I know I've kind of exploited that in the past, but yeah, I thought it'd be more useful if we could do like a results reflection, just have a few weeks to process it so I can actually analyze what I could do differently, like what are the good things and bad things from last year and how I'm going to use that information going forward. So yeah, let's just start off with what you've probably been waiting for, my exam results. We had 2 exams this year. We had the written paper, which was just 150 multiple choice questions. Then for the clinical section of our exam, we had these 10 OSCE stations. So that stands for Objective Structured Clinical Examinations. And these were split over 2 days. And the types of things you're asked to do in OSCE is to examine a patient and present your findings to the examiner, also take histories, and then there was one station where we had to break bad news to a simulated patient. Okay, so the results themselves, in the written paper I got 93.3%, and in the clinical paper or the clinical exam, I got 78.6%. Yeah, so let's start with, I guess, with the better score, the written paper. I was really pleasantly surprised with the result because I did find the paper quite challenging, and at least like for 15% or 20% of the questions, I was guessing between 2 or 3 different answers. So yeah, I'm happy that went that way, and I guess it validated kind of the study process which I did for that exam. And I think they released the cohort distributions. My written paper puts me in the top 10 in the year, which was pretty exciting. And yeah, the clinical exam, well, I didn't really know what to expect because this is our first set of clinicals we've ever done. So my cohort, I think it puts me in like the top 3rd-ish in the year, but it's honestly quite hard to say because they only gave us like a cohort distribution rather than your actual ranking. And it's complicated further by the fact that people who sat the exams on different days, they were given different stations, so they were given different pass mark and different cohort distributions. So it's quite hard to say for certain. You had to do a bit of interpolation. But anyway, we can't do much about that. And kind of on a side note, I kind of wish we did have the rankings and they were a bit transparent. I don't know, there's a bit of a culture these days of people being quite protective about what they got, and it's kind of seen as politically incorrect. Maybe this video is a bit politically incorrect, me sharing my exam results like for the whole internet and the whole world to know. I kind of wish I had the rankings. Number one, because I'm kind of a competitive person and I'm not afraid to admit that. But also because I genuinely want to learn, because different people had different strategies going into these exams. So I want to see which strategies have been validated by the exam result. And I actually want to learn from my peers. So if there is anyone who got in like 80s or 90s in the OSCEs, please let me know. I won't be offended at all. I just want to learn how different people approach things and how I can better adapt my strategy for next year. The thing is, we're still waiting on our full OSCE feedback. They've been taking a while to get it back to us. Like, I've been told I passed each station, but I'm not really sure how exactly they marked it because, yeah, we've never really had like a mock OSCE. So it'd be really useful to know where I could have improved and how I can do better. With the result itself, like, how am I feeling about it? Obviously, yeah, the written paper was nice, but I was slightly disappointed with the clinicals just because I do feel I prepared quite hard for them. I was practicing the routines and I knew them very well in the 6 weeks leading up to the exam. So I do feel that I had it in me to maybe push into the 80%. The thing is, the weightings for the overall scores are 60% for clinicals and 40% for the written paper. So I think if you do the weighted average, I'm at 84.5%. Which in itself is good. If you told me at the start of the year I'm going to get 84.5%, I'd be very happy. It's just like with the written paper being so high and with there being quite a big disparity between my written performance and my clinical performance, it does leave me thinking maybe if I'd prepared and used some slightly different strategies, I could have done better. And yeah, let's just talk about more of my OSCE experience. This might be a bit like a therapy for me, but I know lots of people in our year were discussing how our different experience was with different stations and different examiners. The whole experience was just really novel for me, like going to the different stations and it for being really time pressured, for examining actual patients. So the people in the years above, they had actors rather than actual patients. So there was quite a lot of clinical science to pick up on, which I wasn't used to. And even the noise, like you can hear what the other candidates are saying or the other students are saying in each adjacent station, which is a little bit off-putting, but to be honest, with the adrenaline, you're kind of just focusing on your own station. And it was also different in a way that we're all sitting the exam at different times. And I was the first batch for both days of the clinical exams, which I do think is a slight disadvantage, but I'm not going to use that as an excuse at all. But it's just because people do leak the stations. Like, I heard of people who literally knew what stations I'd had, who were then going on the next day. It is a bit disheartening when you hear other people, they already know what's on the exam, but they do try to mitigate this by changing up the stations each day. But unfortunately, I don't think there's a great way around it. And I think, yeah, just looking back on it, I know I haven't got the full feedback yet. I think there were some mistakes I made. So with timing, first of all, there was one examination station, it was my cardiac examination station, which I didn't finish, which is pretty bad. I mean, I didn't even get onto the examining the patient's back. The cardio exam isn't that long, but it was one of my first stations, and I went into the mistake, and I think lots of us make this mistake, is that we list loads of negative findings, like, oh, no Janeway lesions in the hands, no Osler's nodes, and we list all these like pointless negatives, rather than looking really closely for any positive signs and just saying to the examiner, I'm examining the hands, I'm examining the face. That would be a lot quicker than listing off like no like central cyanosis, no corneal arcus, all these little negatives. Looking forward into the future, I know I need to practice more to time and practice not like narrating a ton about all the negative findings, but really focus looking out for the positives. And I think what I'm going to do, try to modify my time on placements to try prepare better, is to do mock OSCEs on actual hospital patients and try get a friend to then mark me on each of the points and pay a particular attention to getting any positive signs. Well, I think a lot of people did struggle with the timing and listing all these negatives is because we tend to practice on each other as we're trying to learn the routines. But the thing is that because we're all like young people, we don't have many clinical signs of note to find. So we get very used to just saying, oh, this is a normal exam, and then we fill up the time by listing every negative to try, in a way, get more points. But even then, we don't really know how the OSCEs mark. This is why I wish they were a little bit more transparent with releasing some of the mark schemes, just so we know how exactly is it scored, how much do you need to mention all these small things, or is it more the overall process as a whole? I'm not really sure, I think I'm kind of waffling, so I won't bore you to death. For some reason, I felt really quite nervous and frenetic, particularly on the first OSCE. So on the Monday morning, we had to go in at 8 AM for the briefing, it was really early. I felt quite nervous going into some of those stations, like even the practical skills station, my hand was kind of shaking, so again, I didn't quite finish that station, so I was leaving marks on the table. So yeah, I should have really just tried calming myself, just do some deep breaths, but somehow all of that went out of my head when I actually stepped into the exam. So that's a useful thing to bear in mind for next time, just try to take a step back, relax, and probably talk less and focus more on the process and picking up the signs. There's also one station on the second day which is just completely different. Basically, the clinical school, they release like a list of presentations which you should learn, like chest pain, abdominal pain, which the simulated patient might have when you're expected to take histories. So I learned all of them quite well, and I learned like the basic structure of the histories and practiced them with some of my friends and then even some of patients we saw on GP and things. But this other station, I won't say it just for in case I'm supposed to still keep it confidential, but it was just completely different and it completely threw me off. Thankfully, it was the last station, and I guess they did keep a station like that to differentiate candidates who can think on their feet versus those who just prepared, like me, I guess. I did end up passing that station, but I guess the one annoying thing I found about that is people will find out that that type of big span in the works, people will leak that, and me being the first person to do it is, or like the first group to do it. I don't know, it might have been a disadvantage. Obviously, I don't have any evidence to prove it, and it's all done, and I still passed. But yeah, that was just a bit annoying, and hopefully, maybe like next year in the exam season, I should just practice some really random stations and just see how I adapt to a new situation. Anyway, that's enough complaining for now. Just kind of an overall reflection, like 84.5% is still a good score. So I definitely need to praise God and thank Him. And it's not just because, you know, I'm a Christian, so I believe God gave me this good result. That's not how it works. That's called like the prosperity gospel. But the fact that God gave me like the good health to be able to study and kind of the time and then the environment in order to be able to practice and then to do well in the exams. Those are all things which I should be grateful for. Not everyone has those opportunities, and even to be studying here in Cambridge. Okay, so now for the next part of the video, let's look back on fourth year in general. And I think it was kind of like a mixed experience. It was really good. It was our first clinical year in that we finally got to see the patients go in the wards, do examinations, and I really actually enjoyed that side of it. So it definitely kind of affirmed I'm doing the right course, and I do think I'd enjoy being a doctor. So that was all very positive and reassuring. It was quite a long year. It was like, we started in September and our exams were in July, which was a first for us. So it was a little bit annoying, just like everyone, all the other students had kind of finished in June and already cleared off for their holidays, and we were still like in the library, but we can't do much about that. At least we got some holidays. And overall, it was a fairly relaxed year in that, because I think it's kind of like the same amount of work, but it's just spread over a longer period of time. So there was like time to like take weekends off, have some downtime. Even like the day-to-day part of it, like yes, there was going into placement, but you could balance that with kind of your own work in the library. So in a way, there was some flexibility, which was really nice. But there definitely were some challenges and frustrations, and part of it was just kind of not really feeling I'm having a grasp at clinical medicine and just feeling pretty like low competency throughout most of the year. And particularly near the start of the year, like I was going into placement like probably too much. I was there from like 9 till 4 every single day. I was listening into these ward rounds, but I had no idea what was going on. I still didn't know how to like, I don't know, manage or diagnose someone with a heart attack and stuff and do basic things. And it took a while to develop those skills. Particularly our first placement when I went off to Bedford, we'd had that before we'd even had any like formal teaching on like how to take blood or even some like basic conditions. I had no idea. So I was just kind of there on the ward, but clearly I was just really out of my depth and had to learn on my feet. And for some people, they like that. They like just being thrown into it and having to work things out. But I'm the type of person who kind of likes to know the theory first before kind of jumping into things, which is kind of why I picked the traditional course. But I guess it worked out with my rotations that I had a lot of placement before some formal teaching. And even the way it's taught this fourth year and our placement schedules, it's a little bit random, a little bit here, a little bit there. And it's not like we have like strict modules. For example, in other medical schools, they might have like 1 or 2 weeks of cardiology teaching, and then they go onto the wards and just see cardiology patients. And then they'll have the same thing for neurology and respiratory and so on. We didn't have that. Like one day we would go into the wards, might be an endocrine ward. I was on an endocrine ward for a bit. And then we'd have a seminar on like falls in the elderly. And then, so it's kind of hard to, for me at least, to structure my learning. And this is very different because all my relatives in India, quite a lot of them are medics, and then they're asking me what subjects I'm studying, and they're probably expecting like ophthalmology, like I don't know, vascular surgery and stuff like that. And I'll tell them like general medicine, general surgery, because that's technically what we could be tested on. And I guess that's what caused a little bit of anxiety going towards the exams, in that the actual scope of what they could test was so broad that none of us really felt like competent or confident going into the exams knowing what could and couldn't be tested. So we really try to learn as much as possible, which it could be good. So even though I haven't really done any studying for the last month, I feel like I have a good grounding of kind of lots of different things in medicine. It might only be to a basic level, but still, I can tell you about common conditions in ophthalmology or ENT and stuff like that. But it was kind of going through the process a bit challenged to know what to do. And yeah, it did force me to kind of take ownership on my learning. Quite a lot of my learning this year was doing a lot of kind of online questions from online question banks like PassMed, getting them wrong and then looking at the stuff I get wrong and then slowly improving my scores. And in that way, I really enjoyed my studying this year because it was just an MCQ exam we were studying towards at the end. And the OSCEs were different, but the theory was kind of test by MCQ. You could use these question banks and it really felt like a video game, trying to each day improve your score, then adding another section and then can you complete that section. That's how I learned lots of these smaller specialties, which we didn't have that much teaching or seeing patients on the ward. I learned a lot of it by just doing PassMed and getting questions wrong and learning from that. And that positive feedback loop I really enjoyed. A theme which I've been thinking about a lot this year is not complaining, because I think medicine in particular has a really bad culture of complaining, which, yeah, I was probably guilty, and probably a lot of this video is me complaining, so apologies for that. I went to this Christian conference, this National Christian Medical Fellowship student conference in February. I went to a seminar called Shining Not Whining. Particularly, I think they were focusing on one verse in Philippians 2, where it says, do everything without grumbling or arguing so that you may be blameless or pure. This actually convicted me quite a lot because I realized I was just complaining a lot to other people about my situation and having more of a victim mentality. But I think I did do better in the second half of the year. Like, even though like other people around me were complaining, I was just trying to see what can I actually do in this situation and just really keeping my expectations quite low, and anything above that and any good patient encounters I had, that was just all a bonus. And yeah, I'd try to take more ownership over my learning. One thing I found quite hard was, I think I'd complained so much to my family or whatever, that they now then started complaining on my behalf. And I was just sitting there in silence, not really knowing what to do, because I know I'm not really supposed to join in with the complaining, but at the same time, so that's something hopefully next year I can have start off with a more positive attitude as well. I think now my attitude's going to be going forward is to take the most of opportunities which come my way, whatever they may be, just keep my expectations low, and whatever I can't control, just leave the rest to God. I guess just to give a full rounded perspective of fourth year and how it went for me, one thing which I did find a bit disappointing was, I don't really know how to explain this, but I don't feel I grew that much as a person compared to the first 3 years. That might sound silly because I had so many of these new experiences, talking to patients, traveling on my own to placements for the first time. Yeah, but I don't really know how to describe it. But yes, I did work consistently, I put the hours in, but I didn't feel there was that intensity or even like aggression or that competitiveness like I've had in previous years. So in a way, it felt like I wasn't really reaching my potential, and it just felt like I was coasting along a little bit without really having goals I'd set and going out to achieve them. Like, even in other domains of life, for example, spiritually, to be honest, I don't feel I progressed that much, and sometimes my Bible reading has been a bit flat and not that enjoyable. But because I know it's a good habit, and I know it keeps me grounded and closer to God, I know I still keep up with it. Physically, for example, I did have an intention to run the London Marathon earlier this year, but then I got an Achilles tendon injury, so that put a stop to that. Yeah, even with this academics, like, I wasn't really sure what I was striving for. So I'm not sure if that makes any sense, but hopefully next year I can fix it. But that being said, it shouldn't all be doom and gloom. I shouldn't be putting that across. There were definitely some highlights from this year, and I did overall enjoy the year. It was just a mixed experience. Okay, so looking forward to fifth year, which starts in like a few days, which is way too close. Fifth year has a reputation of being quite intense. Like, some people say it's almost as intense or maybe even on par with second year. I don't really know how that's possible. I've already made a video about second year. I've heard it's to do with just you have to keep on top of a lot of your fourth year stuff, but also there's a lot of new specialist medicine stuff to learn and specialist surgery. There's also one exam for us which has a very heavy emphasis on pathology, and it's short answer questions, So you really need to know your stuff. You can't just guess like in multiple choice. That path exam is what I've heard makes this year quite hard. But to be honest, I'm actually looking forward to this year more than I was last year. Just because I have 1 year of clinical school under my belt. I'm starting to figure out what works for me and what doesn't work for me. And hopefully I can give this year a really good shot. And I'm also trying to just commit to a certain goals and committing to a certain level of intensity. And I really don't want to just coast along like I sometimes felt I did last year. And 5th year is a bit different in that there are some subjects which have a bit more of an emphasis. So like women's health, psychiatry, and pediatrics. I think those are the main 3, but obviously there are some others as well. Although none of these specialties really interest me that much, I am looking forward to kind of learning them well and learning them to a greater extent. Rather than last year where I felt like to cover all my bases for that written exam, I really had to cast my net wide and just learn lots of things briefly. There's also the medical elective towards the end of the year, so in summer 2024, which I've been trying to plan at the moment, but it's honestly been quite a pain. Kind of thinking I want to do a bit of neurology and a bit of dermatology and maybe have that dermatology abroad. I don't like it when there's too much choice, and obviously with elective you can go anywhere in the world, providing you get the funding for it. So I'm just trying to narrow down my options now, but it's just been a bit annoying. And one thing which has been a bit annoying is trying to think whether I want to go to America or not, because basically my objectives from the elective is trying to see a healthcare system which in a country where I can envisage myself living in the future. So realistically, to be honest, that's going to be an English-speaking developed country. So that does nicely limit down your options to like US and Australia, Canada, New Zealand. But the thing is with US, there's a lot of factors like if you want to have an elective there, there's quite a lot of preparation which you'd have to do, so lots of institutions ask for step 1, USMLE step 1. It just seems like a bit of an ordeal to want to go to US, but at the same time, a lot of people say if you do have the intention to go to US in the future, you really should take this opportunity to do an elective when you're still a student, because you can use that to get like letters of recommendation from doctors over there. It's a bit confusing because it sounds like a bit too much effort in my opinion, and I feel like I might find it easier to go to maybe Australia. But yeah, that's just a side point, and we'll see I'll give you an update as I work things out throughout the year. Okay, so let's just round off the video by setting some goals, because yeah, why not? I can look back on this in a year. So I guess start off with fitness, because fitness is, I think it's one of the easiest ones to set a goal and then work towards it and achieve, provided you put in the effort. I've actually started going to the gym recently. I know it doesn't look it, I've only been for a few weeks now. Yeah, I've always had this idea that in the future someday I'd go to the gym, but I thought why not start now during some holidays, so I did. Why am I doing it? Well, Andrew Huberman, of course, he says that resistance training is good for not only for brain function as well, but for offsetting muscle loss or sarcopenia in older age. Yeah, there's some health benefits. But also, I do have a theory that men, specifically men with greater musculature, they are treated subconsciously a bit different by society. And I feel like subconsciously that might just build my confidence a bit more, which might help me just assert myself a bit more on placement, not to be impolite or anything, but just to really say to the doctors who are there, hey, this is what I want to get out of the placement. Rather than a lot of the time I felt like I was just kind of standing by the side or staying in a clinic for way too long, even though I know my time would be more spent useful either at home doing bookwork or even in other parts of the hospital doing different things. Those are kind of tangential reasons, but I guess it's also another challenge. I've never been to the gym. I've always been quite small and skinny, so I thought this is a new challenge to try. And for academics, I'm going into this year thinking I want to get in the top 10% of the year. I think this means you graduate with a distinction. I think if you keep your score consistently in the top 10%, but I'm not really sure. No one's really sat down and explained that to me. I know I have the potential to work to that level or close to that level given my written score, but I really want to make that intention more clear this year, so I work more intently, more focused. I've been watching a bit of Hamza recently, and he's been saying a lot of masculinity is found in kind of pursuing and achieving goals, and that's how you say it on like your purpose, and the purpose in life is to keep progressing. That was one reason why I really enjoyed doing pass med throughout the year and seeing my scores improve. And hopefully this year I can work with a bit more focus towards certain goals. So one thing I've thought about doing now when I go back on Monday is to start waking up a little bit earlier to try and maximize the amount of deep work I can do in the mornings, even before going to placement, even if I need to get in by 8:30 or 9 o'clock. If I can get like an hour of work in before that, I'm sure they'll pay dividends later on in the year, because I know it works best in the mornings rather than in the evenings. And finally, just a quick other goal, so kind of social, in the social domain, if you want to call it that. I want to focus more on connecting with male friends, particularly like on a one-to-one basis, because I felt like I spent quite a lot of time in groups, kind of in church, or even socializing with house and different people, friends who come over. But what I valued most from last year is connecting with people one-to-one. So whether it's my brother when he comes over and we have dinner together, and even one of my closest friends, we became really close this year, and we have like weekly calls on Zoom, and I find them really energizing. So hopefully I can invest more into these, because I really valued them this year. Okay, so that was quite a rambly video, but hopefully you enjoyed finding out what's going on in my life and what I thought of last year and what my intentions are for next year. If you like this video, please consider subscribing to the channel. But anyway, take care and bye for now.